Hey guys, it's Dr. Scott here. If you're watching this, you're probably one of my students. I'm trying to put a concise cervical, thoracic, lumbar vertebrae video together. Definitely use your other videos. I know this is not state of the art. There's more YouTube videos that go into a lot more detail, but I wanted to at least do something that I felt was a little bit more concise for studying purposes. So what we're looking at here from left to right, and we've covered this all in class, or we will be covering in class, depending on when you're listening to this, is we have our vertebrae facing anteriorly. Okay, just so if you had the client's back to you. Okay, we have our atlas, which is C1, C meaning cervical, our axis, which are two of the three atypical vertebrae. They look a lot different. A typical cervical vertebrae, a thoracic vertebrae, and a lumbar vertebrae. Okay, we're not going to cover the sacrum in this video. So we said C1, C2 being atypical vertebrae. The first one I want to take a look at is the atlas. I'm going to move this off screen here, these other vertebrae off screen for the moment. So we're looking anterior. First thing you can see is there's no vertebral body. Okay, the other vertebrae, which I'm moving off to the side, you can see on this typical cervical vertebrae, there's a vertebral body, and the thoracic and the lumbar. Lumbar is going to have the largest vertebral bodies for weight-bearing purposes. But we do have the anterior tubercle on the anterior side, posterior tubercle. Okay, we're going to have the arch, vertebral arch. The vertebral foramen is right here. So this is where the beginning of this spinal cord is going to pass through. Then you're going to have your lateral masses, okay, on both sides with your facet joints. Okay, now the facet joint on the atlas, which again is C1, is going to go up against the occiput of the skull if I had it sitting on here. Okay, you're going to have your transverse foramen, which is this hole. Foramen is a fancy term for hole, where the vertebral artery is going to pass through. Okay, and your transverse processes. Okay, so anterior tubercle, transverse processes, facet joint, or the lateral mass, which is the entire portion here. The vertebral canal, posterior arch, and posterior tubercle. Okay, remember, atlas is not going to have a standard spinous process. Okay, so what I want to mention before we get into the axis, which is C2, is the odontoid process. Okay, bring it down here on C2, which I'm just about to explain, joins with the atlas just like this. So there'll be rotation occurring. Okay, right here, rotation occurring. All right, so I'm going to pull the atlas C1 off and leave us the axis. Again, this is an atypical vertebrae. Here's the continuation of the vertebral canal. You see there is no distinct vertebral body. Okay, this is the odontoid process, or we also call it the dens. That was what just went to the anterior arch of the axis. Okay, here's your lateral mass. This articulating process is going to go up against C1, as I showed you before, to join like this. So it's going to be a rotation occurring. And there's ligaments and everything. Then you have your, again, transverse foramen, your transverse process, the lamina, two lamina come together to form the spinous process. Now, on the cervical vertebrae, you're going to see it on the next one, they have a bifid cervical process, which means if I take my two fingers, kind of like this, jutting out. So those are distinct features of cervical vertebrae. Okay, so that would be C2. A typical vertebrae. Now, we're looking at a typical cervical vertebrae. Now, this was taken off a model, so there's no hole here through the vertebral body. Okay, so this is normal. So you can have your body, you can have your transverse process, your transverse foramen for the vertebral artery, your lamina, two lamina coming together to again form that bifid spinous process here. Okay, so you can rotate that out. So again, this is anterior, where my marker is now, and this is posterior towards the back. Okay, so again, body. Okay, one thing I failed to mention, there's the pedicle, okay, which goes between the body and the lamina. Okay, so in the vertebral vertebral canal. So that's a cervical vertebrae. Thoracic vertebrae, okay, then you're going to notice the bodies get bigger. Now this is actually T9, T meaning thoracic, okay? If you look at the side of a thoracic vertebrae, the spinous processes start jutting posteriorly more, okay? Sometimes they even go kind of like this on the side, and we'll discuss this in class. But looking from the top, you're going to have your body, 2 pedicles on either side. You're going to have your transverse process, 2 of them. And you have your 2 lamina here and here coming together to form the spinous process. And this one, you'll feel jutting out, straight out towards you. So if you feel your back yourself or you're palpating a client, that's what you feel on the back side, so your spinous process. So you should be able to drill. And then here are your facet joints, your superior articulating facet for the vertebrae above. And then you're going to have your, if I tilt it down, the inferior articulating facet for the vertebrae below. Okay. Now I want to put you on the side here. We don't see on the thoracic vertebrae, you're going to have these little demifacets, these little spaces for the rib. They're going to attach from the body as well as the transverse process. And the rib is going to come around, wrap around towards the front. So there'll be demifacets on thoracic vertebrae. The other thing I want you to look at all the vertebrae when they stack on each other, there's an intervertebral foramen. Okay, not the vertebral foramen where the spinal cord is coming through. Intervertebral. So there's another vertebrae here, inferior. It's going to form kind of a figure 8 oval space for the intervertebral foramen or the vertebral spinal nerves. Okay, and then you can see the body. So body, pedicle, transverse process, lamina on one side, and the spinous process is where I'm holding it on right now. If you get to lumbar vertebrae, same thing. You can see there's a bigger, thicker lumbar body, okay? So you have your body, you have your pedicle, 2 pedicles, okay? Remember, the spinal nerve is going to exit underneath the pedicle. You have your transverse process on each side. You have your superior articulating process to form with the vertebrae above. So there's going to be one on the right and one on the left. That's going to have the facet joint. That's going to have 2 vertebrae on top. And then you're going to have your 2 lamina forming your spinous process. Okay? So on the side, you can see the spinous process comes more posteriorly. And right in here is underneath the pedicle where there's the the spinal nerve is going to be exit out, or the intervertebral foramen. Okay? Worth noting, on top of the bodies, okay, especially in most of the cervical, thoracic, lumbar vertebrae, your intervertebral disc now are there. Now I'm going to bring a full spine, okay? Worth mentioning here is we'll show you in this segment, but you can see you have body, disc, body. You have these little yellow spinal nerves exiting through the intervertebral foramen, okay? Transverse process, spinous process, and of course the lamina on either side. So this is if the person, we're looking at the right side of their body. Now if I turn you straight towards the back, their head is over towards the right of your screen. The buttock area, gluteal area is on the left side of your screen. So you can see spinous process, okay, 2 lamina, and your transverse process. Now recall the transverse processes, okay, are of the thoracic vertebrae are above the spinous process of the same named thoracic vertebrae. So remember, we have 7 cervical vertebrae, 12 thoracic, 5 lumbar. So we'll count, I'm not going to look at it real close right now, but say T5, 6, 7, 8. So you can see there's a difference here. So you're palpating this superficially. Okay? And like I said, it shows you on the side where you have your intervertebral discs, which are little gel-nut shock absorbers, and you can see the proximity of the disc to the nerve if there is any type of herniation. Okay, so again, you can look at the side, body, pedicle, transverse process, lamina on one side to form the spinous process. Okay, guys. Hopefully that helps. Just one more, thing in your arsenal here to study besides the notes. Videos from A&P, some of the software you've been given. Definitely, I encourage you to look at other YouTube videos, but I try to hit the